Let's think now about the first aid principles that we can apply in burns. And it's very important to know about because early first aid interventions in burns can significantly improve the patient's prognosis. Now, in any first aid situation, of course, we're looking at A, B, C first: airway, breathing and circulation. The patient must have a patent airway, they must be breathing, and the circulatory system must be functioning. If these aren't working, we attend to these first. Then probably the next thing to say about burn injuries is that the patient might be in a smoky environment, and we want to get the patient out of that smoky environment. We don't want the patient to be inhaling smoke or very hot air or hot gases, because there's a risk of inhalation injury. Hot air and hot gases being breathed into the lungs can damage the airways and can damage the lower parts of the lungs. So get the patient to some fresh air as quickly as possible. Then the next priority is that any burning should be extinguished. We need to halt the burning process. If the patient's on fire, we need to smother the flames. Think about what's making the heat and take that away from the patient. Clothes can remain hot for quite some time after a fire has been extinguished and can carry on burning the patient. So take those off. Stop that heat being conducted into the patient's body. Scalding water. Again, the hot water will sit on the clothes and the clothes are in contact with the patient's body. So again, get the clothes off and stop the transfer of heat from whatever is causing that heat into the patient's tissues. Thermal burns should be immersed in cool water, probably for about 20 minutes. And this provides a lot of pain relief and conducts away the excess heat which is still present in the tissues. Now, keeping a burn or burn area underwater for 20 minutes sounds like a long time, but actually it's not, because it takes a long time for heat to conduct out of the tissues of the body, because the tissues are not naturally good conductors of heat. And if you think about taking a joint out of the oven, that can still be hot after a long period of time, because it retains the heat, and people's tissues are analogous to pieces of meat, and we need to cool them down, and that can take some time. So immersing in cool water for 20 minutes is absolutely fine. As a general principle, it's best to avoid ice water, because if water is very cold, that will cause a profound vasoconstriction, and that will stop the circulation of blood through the burnt tissue. And of course, the circulating of blood through the burnt tissue will help to conduct heat away from the superheated area of tissue. And putting things in ice water can actually reduce that and be counterproductive. So cool water is probably the best thing. Now, infection is a common complication of burns. Burns are actually quite likely to become infected. So we can think about how we're going to prevent subsequent infection in the first aid management of the patient. So we can cover the patient's burn with a clean, moist sheet. Or actually, if it's available, probably the best thing is to use kitchen cling film. Cling film can be laid over the surface of the burn once we've cooled the burn down, once the burn is out of the cold water. And this will provide a bacteria-proof layer across the surface of the burn. So any bacteria from the outside that would have settled onto the burn injury won't, because the cling film will protect it. Now, if there's chemical burns caused by chemicals or powders, these should be brushed off the patient's skin as quickly as possible, and then the skin should be rinsed under running water. And again, large volumes of water, probably for about 20 minutes. Make sure that all of these potentially dangerous chemicals are washed off the surface of the patient's skin. And don't bother trying to think if it's an acid or an alkaline and what you could neutralise it with, because if there was acid on a patient's skin and you put an alkaline on it, that will produce more heat anyway. The thing is just to physically wash it away. Prompt irrigation. Get rid of it. And it's the same if there's burning chemicals in patients' eyes. I mean, cement dust is a classic one for this. It's a very strong alkaline, and it can burn into the corneas and really damage the eye. And in fact, if cement dust is left in a patient's eye for any period of time at all, it can cause corneal scarring, and it can cause blindness in extreme cases. So just wash it out as quickly as possible. Large volumes of saline or water to wash it out. And of course, we should always wash with eyes from the inside out the way. What we actually do on A&E departments is we'll anaesthetise the patient's eye and then irrigate it with normal saline for quite a long period of time, running large volumes of saline from the inside of the eye outside to wash away all of the irritating chemicals. I think the last one we'll mention in first aid principles is electrical burns. Now, obviously, the danger here is that you get electrocuted yourself. If a patient is connected or a victim of electrocution is still connected to the current and you touch that patient, you too will be electrocuted, and you'll be no good to the patient because you'll be electrocuted as well. So we have to make sure the current is disconnected first before we touch that patient. Or we use some insulating material like wood, or as long as it's dry, to disconnect the patient from the current. Now, electrical currents tend to cause deep injuries, so there's not too much we can do about those in the first aid situation, other than get the patient away from the current as quickly as possible. And do bear in mind that cardiac arrest is a possible complication of electrocution. So particularly important to monitor the patient's circulatory system.